When a child is in a medical emergency, every single second counts. So what does it actually take to save a life? Today, we're going to break down these step-by-step protocols, from that very first assessment all the way to the most advanced professional care. First up, we're going to tackle the fundamental difference in how kids and adults go into cardiac arrest, because it changes everything. Then we'll follow the logical flow of an emergency, starting with the universal ABCDE assessment, moving into basic life support, then the PROS toolkit with advanced pediatric life support, and finally, we'll look at the super specialized world of newborn resuscitation.
All right, before we dive into any of the treatments, there's this one huge idea we've got to get our heads around first. It's a concept that completely changes how a medical team responds to a crisis.
Okay, so here's the absolute game changer. With adults, a cardiac arrest is often a sudden primary heart problem, but for kids, it's almost always secondary. Their heart usually stops because their body has run out of oxygen first, maybe from breathing problems or shock. And look, this isn't just some tiny detail. It's the whole reason the entire rescue approach is totally different. It all comes back to oxygen.
So you're faced with a seriously ill child. Where do you even start? Right? Well, you start with a super fast structured check that's used everywhere to find the really life-threatening stuff immediately. It's called the ABCDE approach. Just think of it like a rapid-fire sweep of the body's most important systems. First, A is for airway. Simple question. Is it open and clear? Then B for breathing. Are they actually breathing effectively? For C, circulation. You're checking things like heart rate and how quickly color returns to the skin after you press on it. D stands for disability, which is a quick check of consciousness on the AVPU scale. Are they alert, responding to voice, responding to pain, or totally unresponsive? And finally, E for exposure, where you do a full check for injuries, rashes, or a fever. Okay, so once you've spotted a problem, what's next? That's when the first level of help kicks in. We're talking about basic life support, or BLS. And the amazing thing about it, anyone can do it anywhere, right away. The name really says it all. BLS is exactly what it sounds like. Life-saving stuff you can do with literally nothing but your own 2 hands and your breath. It's that absolutely critical bridge between the second a child collapses and the moment the pros arrive with all their gear. Right, so what happens when the paramedics or doctors show up? Well, they take all those basics and they level them up, following a protocol called Advanced Pediatric Life Support, or APLS for short. This is where all the specialized gear and drugs come into play. You can think of APLS as the official playbook for doctors and nurses. It takes that foundation of BLS and just starts adding layers. We're talking advanced airway gear, IVs, specific drugs, all laid out in a super clear step-by-step plan. And check this out. This first number 5, it takes us right back to that first point we made. Remember how we said a kid's arrest is almost always about a lack of oxygen? Well, there you go. That's exactly why APLS kicks off with 5 initial rescue breaths. Before they do anything else, they're trying to fix that core problem, hypoxia. And it's not just the start. Even the rhythm of CPR is different for kids. For a single rescuer, the go-to ratio is 15 chest compressions followed by 2 breaths. It's all about finding that perfect balance, right? Enough compressions to keep the blood moving, but always with a huge focus on getting more oxygen in. And hey, what if you need a defibrillator? Well, you can't just wing it. It's definitely not one size fits all. The dose is super specific. It has to be calculated based on the child's weight. And the number is 4 joules per kilogram. It just goes to show you how detailed and tailored this APLS approach really is. But what if it's not working? What if the CPR and the shocks just aren't doing the trick? I mean, that's the nightmare question for any medical team. And when that happens, they have to switch gears. They basically become detectives, hunting for some other underlying cause that they can actually fix. And this is their detectives checklist. The team will literally run through these 8 potential culprits. They call them the 4 H's and 4 T's. Could it be hypoxia again? Or maybe a collapsed lung, a pneumothorax? Maybe it's a toxin or a blood clot, a thrombus. See, finding and fixing just one of these things could be the magic key to getting that heart started again. Now picture this. You're in the middle of all that chaos. The last thing you want to be doing is complicated math in your head, right? It's tough and a mistake could be dangerous. And that is where this brilliant little acronym, WET flag, comes into play. It's basically a mental shortcut. It helps the team quickly figure out a kid's weight and then calculate all the right doses for everything. We're talking energy for the defibrillator, the size of the breathing tube, fluids, adrenaline, all of it.
Okay, so let's shift gears to maybe the most specialized area of all, resuscitating a newborn. I mean, we're talking about the very first minutes of life. The challenges are completely unique, and the stakes, they couldn't be higher. So, what do you do for a newborn who isn't breathing? Well, you might be surprised. The approach starts off remarkably gently. The very first things they do are provide warmth and dry the baby. And you know what? A lot of the time, that simple stimulation is enough to get them to take a breath. But if that's not enough, they move on to the next critical step, giving 5 slow, gentle inflation breaths to help open up those tiny lungs for the very first time. Now, what if they actually have to start CPR? Well, that ratio we talked about, it changes completely. For a newborn, it's a 3-to-1 ratio. 3 compressions, then 1 breath. And that really intense focus on breathing just hammers home the main goal here. Get the lungs working properly. And hopefully, the heart and the rest of the circulatory system will follow suit. Wow. I mean, if you need one single statistic to really grasp how fragile a newborn is, listen to this. For a very premature infant, every single degree Celsius their body temperature drops, the chance of mortality goes up by 28%. 28%. That just shows you that, in this world, something as simple as a warm blanket isn't just for comfort. It is a critical, life-saving medical treatment. So what's the big takeaway from all this? It's that this entire system we've walked through is built on one single, powerful idea. A child is not just a little adult. And from that one insight, this whole incredible framework just unfolds. A series of practiced, deliberate steps, all designed to do one thing: turn a moment of absolute chaos into a focused, systematic fight for a child's life. It's just an amazing reminder that when things are at their worst, a clear plan might just be the most powerful tool you have.